Hello, 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 hello. This is Dr. Brony from the MedCognito group. So if you are joining us, if you're seeing us currently, you are either joining us on Facebook or you're joining us on YouTube. For this very important live stream on how to deal with patient positioning concepts on NCLEX. Okay, patient positioning concepts on NCLEX. So, and we also have a few people also join us on Zoom as well. So, if you're joining us on Zoom, I just want to know, can you see my screen? Can you see my screen? And those who are joining us on YouTube and Facebook as well, can you also see my screen? If you can see my screen, just type yes, 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 yes. Just so before we can get into the system, okay, just type yes so that I know that you are all on the same page with me and we can start the game. Okay, so if you can see my screen, whether you're joining us on Facebook or you're joining us on YouTube or you're joining us on Zoom, please just type yes, 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 yes. Just type yes and then let's go. Okay, just want to make sure that you're seeing it and then we can take off from there. So those on Zoom, just type yes. Those on Facebook, so it looks like the Zoom people can see it. Awesome. And those join us on Facebook as well. Beautiful, beautiful. Dr. Mercy is seeing us. Katie is also seeing us. Mercy Samuel is also seeing us. And then Grace and Favor is also seeing us. Beautiful. And then we also have Danielle Watson. Danielle Watson. So this is, a learning point for our DNSing colleagues. So this is a preparatory class for those who are going for the NCLEX. So you know what? If you are seeing it, just type yes, and then let me know, where are you joining us from? 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 Are you joining us from Canada, from the US, from the Philippines? Where are you joining us from? Just also encourage your friends to also join us right away. And I can see quite a number of you also join us on YouTube. Please make sure, go to our YouTube channel right now and click on the subscribe button. Click on the subscribe button and also share this link with as many people as possible. Okay, share this link with as many people as possible. So just tell your friends that we are starting the class and they should join us right away. Some are also joining us in our Facebook group. If you're not in our Facebook group, please, I want you to know that we have a special Facebook group, and I'm going to share a link to both those on Zoom and those on Facebook and those on YouTube, so you can use that to join. Okay, so if you're not in our Facebook group yet, that is the link I'm posting. Kindly make sure that you click on it to join us right away. Okay, in the Facebook group. So I'm posting it in the Zoom link, and I'm also gonna paste it in the YouTube and then the Facebook live as well, so that you can see it and just click on it to join. Okay, so if you're not in our Facebook group yet, don't worry, we're going to get you in there. We're going to get you in there. So let's go. Are you in the Facebook group yet? Please, have you seen the link? If you've seen the link, just type yes, yes, yes. If you don't see the link as well, just let me know and we will send you the link. I'm putting the link of the Facebook group as well in the comment section. I just want to make sure that we are all set up before we move. Okay, so just click on the link, whether you're on Facebook, whether you're on YouTube, click on the link to send you straight to our Facebook group. Please make sure you send in a link to as many friends as possible. Let's get the ball rolling. So, as usual, as I said, this is Dr. Brony. I'm one of the teachers at MedCognito, and this is a class for our nursing students, our nursing candidates. So, if you are preparing for the NCLEX, this class is for you. This class is for you. So, let's get the ball rolling. We have a beautiful opportunity for you to ace your MCQ1 exam, your NCLEX exam. I'm sorry. We teach so many courses at MedCognito, so at times, yeah. So we have, an opportunity for you to ace your NCLEX exam, okay? And this is the reason why we are conducting classes we are conducting, okay? So wherever it is that you are seeing us, you can be able to join us and get the best out of this. And I just want you to know about this very important opportunity and why it is important for you to take advantage of it. It is not enough for you to be reading your various NCLEX books, to prepare for the exam. What you also need is to get into an exam taking mode. And that is why at MedCognito, we are not here to just disseminate information. Rather, we are also here to put you in the exam mode. Okay. So, for only $29.99, we have an NCLEX mock exam coming up. And we've had some people take the mock, so you can see one of our responses who says that, the mock exam was great. The content taught during the lectures helped me to answer majority of the questions. So, you know what? You've been learning for your NCLEX for a long time and you want to give your preparation a facelift. I will encourage, do your best to put yourself in an exam taking situation so that you can get the best out of your exam preparation. So if you're interested in that, at the end of the class, I'm going to share the link so you can use that to join us. Also tell your friends, tell a friend to tell a friend to tell a friend, so that they can all join us for us to get the best out of our NCLEX preparation. Okay. And like if you are doing mocks, it helps you to know your level of preparation, right? It's not enough just to be reading material. Okay. Now, why is today's class important? If you look at the way the NCLEX exam is distributed, approximately 6 to 12% of NCLEX questions fall under physiologic integrity category. Okay, so that is what we are going to focus on today. So let's say give and take 10% of the cases will fall on that. So that means 1 out of every 10 cases you will meet will fall under the physiologic integrity category. And that is why we have chosen a topic from that to deal with today. So today we're going to dive into patient positioning. So please, if you are following me, whether you are following us on YouTube or Facebook or on Zoom, just type position. I want to see you type position, because we are going to dive into patient positioning. So please type for me position so that I know you are with me. All right, just type position. Whether you are beautiful, just type position. Okay, position. Let's get the ball rolling. Position. So we're talking about patient positioning today, and the first thing we want to understand is the goals of patient positioning. The goals of patient positioning. The primary objective of patient positioning is to protect patients from immobility-related injuries. Why are we talking about patient positioning today? To deal with immobility-related injuries and physiological complications. So I want to take us through some of the goals of patient positioning. Number one, we put patients in some unique positions so that we can help to support their airway and circulation. That's one of the goals, okay? The other reason is also to prevent complications of procedures we are about to do, and also to prevent complications of some conditions the patient may have, the patient or the client, okay? And we also focus on patient positioning to reduce the risk of injury to that particular client, because some people, when they assume a particular position, they can have nerve damage, they can have extensive body extension, and you want to avoid all these things, or extensive body flexion. So you want to learn the various positions which can help you when you are dealing with your clients in the hospital, whether in the home care setting, wherever, so that they can get the best out of it, and you can also make sure that you are safe and they are also safe. Another reason why we have to learn about patient positioning, and you are going to be quizzed on that in your NCLEX, is so that we learn to maintain patient dignity and their privacy. What do I mean by that? Especially when you are doing surgeries, right? Positioning should minimize unnecessary exposure. because if someone's private parts are exposed, it does not speak well, right? So you want to learn the various positions patients can be placed in, so we minimize unnecessary exposure and respect their dignity. And another thing is to facilitate maximum visibility and access. So if you are supposed to do a particular procedure, you want to know this particular procedure I'm going to do, which position should the patient be in, so I can get maximum visibility and be able to help the patient and the surgical team alike. So before we move on, I just want to ask who can type some of the reasons why we want to learn about patient position. I'm going to go through them again to ensure patient comfort and safety. Okay, so please write it down. Patient comfort and safety. Write it in the comment sections. I want to see it. Patient comfort and safety. You want to ensure that that is something which is important. All right. Patient comfort and safety. Beautiful. Katie is following us. Patient comfort and safety. The next thing you also want to focus on is to prevent complications. That's the second thing. Number 3, to reduce the risk of injury to the patient. And then number 4, why do I need to learn about patient positioning? To maintain dignity and privacy of the patient, and to facilitate maximum visibility and access to that particular part of the body on which the procedure is being done. Okay, so these are the places I want us to start the game from, and then we will move on to something deeper. All right, and then we'll move on to something deeper. So now let's go to the next thing we need to cover in class. Let's go. Guidelines for patient positioning. So, what are the guidelines? If you have to position a patient, what guidelines should you follow? The first guideline is, because you want to ensure safety and prevent injury during patient positioning, you want to adhere to some guidelines. The first thing is that you want to explain the procedure to the client or to the patient. Explain. You need to know, why are we putting you in this position? So you can be comfortable. Some positions help them to breathe better, right? And as you communicate to the client may tell you, I feel comfortable, I don't feel comfortable. Okay. The second thing is, because the clients have their autonomy, in other words, they're able to make decisions on their own in most of the cases, you also want to let the client participate fully with you. Encourage patient participation. Why? Because if the patient doesn't know why you are putting him in that particular position, he may not cooperate with you. But if you tell him, we are doing this particular procedure and therefore we need you in this position, the client will be able to easily adjust to that. All right? Now, another reason, or why should we have these guidelines for patient positioning? It is to seek adequate assistance. When repositioning the patient, you want to involve other caregivers if necessary, because you don't want to break your back or you don't want to do everything on your own if you need to stretch out your hand and get some help. Okay. And another reason or another thing which should guide us when we are positioning patients is to be able to utilize mechanical aids. Okay, where you can use things like bed boards, slide boards, pillows, patient lifts, slings, to facilitate safe and efficient positioning of the patient. And you also want to learn how to adjust the height of the bed. Adjusting the height of the bed. Okay. And you also are learning about positioning so that you'll be able to implement frequent positional changes which the patient may need, and ensure that no position is maintained for an extended period of time, which will make the patient uncomfortable. So the principle here is that you want to reposition the patient every 2 hours to prevent complications like pressure ulcers. You want to reposition the patient every 2 hours if necessary. Another reason why you also want to learn about patient positioning is to avoid friction and sharing of the skin, right? Because if you don't position the patient well, there will be a lot of friction and sharing of the skin, and that can lead to a lot of ulcers and complications. So now, if you have to position a patient, what are the things you want to do? First, you want to maintain proper body mechanics. In other words, where should the leg be? Where should the hand be? Where should the neck be? Where should the back be? Okay. The first thing is that for positioning, you want to stay close to the patient. For yourself, for alignment, you want to keep your back, your neck, and the pelvis aligned to avoid twisting. Okay. And then knee flexion, you want to flex your knees and keep your feet wide apart, so that it can give you good body mechanics. And the muscle use your arms and legs for lifting, not your back. So when you are positioning the patient, always make sure that you're not straining your own back, because we are in this nursing thing for a very long time. You don't want to get injuries associated with, positioning the patient, and that can end your nursing career. All right. And muscle preparation. You also want to tighten abdominal and gluteal muscles before moving the patient, so that your body is in a proper alignment, in order that when you are moving the patient, it becomes easier. And you also want to coordinate with others. You don't want to do the work alone. Okay. So now what we're going to do now is to get into various, to learn various positions that we can keep the patient in. What are the various positions? What are the various positions? So I'm going to start with the first one. I'm going to start with the first. The first position you need to know is what we call the Fowler's position. So please write it in the comment section. Fowler's position. Today I'm going to learn about the Fowler's position. Just write it down. Fowler's. Fowler's. Fowler's position. Fowler's position. Why do you need to learn about the Fowler's position? Fowler's position involves various degrees of elevation of the head of the bed. So the Fowler's position is just, a broad term. And we're going to get in and learn various types of, positions. Katie is really, really following. Katie, Conte, Mansari, really, really following. And she's typing in. So whether you're joining us on Facebook or YouTube, just type in Fowler's. So when you talk about Fowler's, it's a broad term. Okay. Now, what are the types of Fowler's positions we need to master? What are the types? Number one, we have the low Fowler's position. Low Fowler's. So low Fowler's, the head of the bed is elevated at 15 to 30 degrees. So please write it in your book. And maybe you can also write in the comment section as well. Low Fowler. 15 to 30 degrees. Now, why do we use this position for clients? It promotes sleep and relaxation by providing comfort for the client. Why should you learn about a low Fowler position? It promotes sleep and relaxation by providing comfort. It helps with patients who may need minimal elevation, such as those with mild respiratory or digestive issues. Okay, so this is the low Fowler position, because after this class, we're going to have a mock exam, and you need to know all these types of positions so that you can be able to answer correctly. And in your NCLEX, you need to master this as well. So the low Fowler is 15 to 30 degrees, and it promotes sleep and relaxation by providing comfort. What's the next one? After the low Fowler, we go to the semi-Fowler position. The semi-Fowler position. With the semi-Fowler, so please, before we get into the semi-Fowler, I want to know, what is the level of degree for the low Fowler? Is it 0 degrees? Is it 1 degree? Is it 2 degrees? Is it 3? I want you to type that for me. What's the level? All right. What's the level? Is it 0, 1, 2? What is the level? What is the level? Just type for me. Just type for me. I want to know. It looks like somebody got it right. 15 to 30 degrees. Okay. That is the low Fowler. Now let's go to the semi-Fowler. In the semi-Fowler position, the head is elevated at 30 to 45 degrees. 30 to 45 degrees. And why do we do the semi-fowler position? It is beneficial for patients with respiratory complications, such as those who have difficulty breathing, and you also want to encourage lung expansion. Okay, it provides comfort for patients who are recovering from surgery. So we've learned the low fowler, we are learning the semi-fowler. Okay, so I need you to type in low fowler, what is the degree? Semi-fowler, what is the degree? I really want to know. Low fowler, semi-fowler. Now let's go to the next one. Let's go to the next one. We go to the standard fowler position. Standard fowler position. Now, the standard fowler, the head moves to 45 to 60 degrees. 45 to 60 degrees, okay? And it is commonly used to relax the abdominal muscles, and it relieves pressure of the abdomen, and it aids digestion and respiration. So standard fowler, please write it down, 45 to 60 degrees. Standard fowler, 45 to 60 degrees. Okay, next position, high fowler. So the high fowler, notice that the patient is almost sitting upright, and that is from 60 to 90 degrees. The patient is sitting from 60 to 90 degrees. That is the high fowler position, 60 to 90 degrees. All right, 60 to 90 degrees. So we started with the low fowler, we've come all the way to high fowler. What other position do I want us to learn about? We have the lateral position, which is when the client is lying on their side. Okay, the client is lying on their side. So we have the left lateral, because you can lie on your left or you can lie on your right. So we have the left lateral position and we have the right lateral position. The left lateral side position, the client lies on the side, and the left side is the part which touches the bed. And on the right lateral position, it is the right side of the body which touches the bed. When do we use the left lateral position? It is for maternal fetal distress and during seizures. Two things: maternal fetal distress and during seizures. Maternal fetal distress, and when the patient is also having a seizure. That is when you put the client on the left lateral position. It's also used for liver biopsy when the client is positioned on the right side afterward to reduce bleeding. So, right lateral position is for um, is for liver biopsy. Left lateral position is for when you want to reduce maternal fetal distress. What about the lithotomy position? Lithotomy. So please, before I move on, I don't want to go through too many positions without knowing that you are following with me. So please, if you're following me, type following. Just type following. I want to know whether you're following me or not. If you're following me, just type following. I want to make sure you're following me. All right? Just type following. I want to make sure that you're following me. So if you're following me, just type following. I want to make sure you're following me, because we are learning so many positions today. Okay, and the position I want us to learn now is lithotomy. So lithotomy position, just look at the way the client has been positioned. The client will lie flat on their back, and their knees are flexed, and their legs are in stirrups. Okay, so it's just like that. It's like a swan neck, right? And it's used for pelvic examination and for childbirth. So please notice that one too. Pelvic examination and for childbirth. If you have a client who stays in this for a very long time, it can lead to blood clot formation. So you want to make sure that you don't keep the client in this lithotomy position for so long. So please remember, Lithotomy, if you want to do any pelvic exam or pelvic, procedures, and especially in clients who need to deliver a baby. Lithotomy. Okay, now let's go on to the next one. Oh, we have some people who are giving us good feedback. So Kokela says following, Grace and Favor says low fowler, semi-fowler, standard fowler, beautiful. And then Lana Bat says following, beautiful. So let's go to the next thing we need to master. The next position we need to master is the prone position. Many people sleep in this position, right? Prone position. Here, the clients will lie on their stomach and their head will be turned to one side. It is used for clients with spina bifida. So please, what I need you to do is every position, write what it is used for. So semi-fowler, what will it do? Low fowler, lithotomy, what do we use for? What do we use it for? And then prone position. There are some clients you need to avoid the prone position in. There are some clients that you need to avoid the prone position in. So you need to avoid it in clients with abdominal incisions because they are going to lie on the abdomen anyway. So you want to avoid it in patients who have just had an abdominal incision, patients who have difficulty breathing, and patients who are unconscious. Because can you imagine if the client is unconscious and then you put him this way, maybe the client may vomit and then will aspirate the vomitus, right? So you want to be very careful with this particular position in people who have had an abdominal incision, people who have difficulty breathing, and people who are unconscious. Prone position. I have a question. Are you okay with the explanation so far? Can I move on? I want you to type. Let me know. Should I move on? Can I move on? If you don't want me to move on as well and you want me to go back to a particular topic as well, just let me know. Should I move on? Can I move on? All right, class, can I move on? If I can move on, just type yes. Let me know. I don't want to rush anybody in this class. I really want to make sure that we are all following. Okay? Good. Okay, so we'll move on. Now, let's talk about the supine position. The supine position, the client will lie on their flat on their back, right? And it is used for clients with spinal injuries or after surgery. And clients should be log rolled to maintain spinal alignment. So don't move the patient in this position alone. Make sure you have other people to help you so that you can keep a straight back and then log roll the client. This position increases the risk of pressure ulcers on bony prominences because there can be a bony prominence here, behind the thigh, on the buttocks, even at the elbow, right? So all these are areas where they can develop ulcers from, on the back of the head, the elbow, the buttocks, the heel. So you want to also be wary of that. But remember that we use it in clients with spinal cord injuries and after surgery. What about Trendelenburg's position? In Trendelenburg's position, it's like the supine position. But the feet are higher and the head is lower. Okay, so you tilt the bed. And why do we use this? Just think about it. If blood flow to the head is low and you want blood flow to go to the head, so you want to tilt the bed so that the legs go up and the head comes down. So in patients with shock, with hypotension, in patients who have prolapsed umbilical cord, because if the patient is pregnant, the umbilical cord has fallen out, the head of the baby is about to press on it. You want this position so that it reduces the pressure on the umbilical cord. And then we also have the reverse Trendelenburg. This time, the head is higher and the feet are lower. and we use the reverse Trendelenburg. Remember that the Trendelenburg was to get more blood flow to the brain. The reverse Trendelenburg is to reduce blood flow to the brain. So it is to reduce intracranial pressure and to reduce blood flow to certain areas. All right. So Trendelenburg is to get more blood to the brain. Reverse Trendelenburg is to reduce pressure in the brain. All right. I hope you are learning something nice today. I hope you are learning something nice today. I hope you are learning something nice today. So reverse Trendelenburg, we've learned what to use it for. What about orthopnic tripod position? So the name even speaks for itself. It's a position which the client is sitting, okay, and they are on the bed, or they are sitting on the side of the bed, and there's an overbed table, and they are leaning on it, and they may have several pillows because the patient may have shortness of breath. The patient may have pulmonary edema, and you don't want them to, you don't want them to sink in their own fluid. And then we also have the SIMS, or the semi-prone position. The patient assumes the posture halfway between lateral and prone position. Okay, remember the lateral position, they are lying on the one side, either the right or the left. Prone position, remember that they are lying on their face, right? And on their tummy. However, the SIMS, or the semi-prone position, the client is not lying totally on their belly, and they are not also lying totally on their lateral side. And the lower arm is positioned behind the client, and the upper arm is flexed, okay? At the shoulder and at the elbow. The upper leg is more acutely flexed at both the hip and the knee than the lower one. So I just want you to imagine it. I just want you to have it in mind so that you know exactly what these positions are. So you know exactly what these positions are. Okay? So because if you know what these positions are, it helps you in the exam. You can be able to remember. You can be able to do what you need to do. Okay. Now let's go to the next position. Let's go to the next position. This is what we call the kidney position. The kidney position. In the kidney position, the patient assumes a modified lateral position. So it looks like the patient is on the lateral side, and the abdomen is placed over the left endooperating table that bends the body. So just think about somebody in the lateral position, but then the body is a bit bent. Okay. Now the patient is turned on their contralateral side with their back placed on the edge of the table. That is what we call the kidney position. The kidney position. Okay. So now that we are done with this, I want us to look at positions for specific conditions. Positions for specific conditions. So before we move into these positions for specific conditions, has this first part been clear? Has it been clear? Has it been clear for you? I'm looking at some of the points people have written. Following, Lana Bates says following, Grace and Favor says following, Lana Bates says move on, Kokoila says yes, and Mask Dribbler says yes. So now, before we move on, we are going to look at specific positions for specific conditions, okay? Because it is not enough to learn these positions and mass. You must also learn, okay, assuming this client has this unique condition, what position can I put the client in? Okay, so now let's go. If you have a client with air embolism, that is, air has gone into the bloodstream, and probably it's gone into the heart. Use the Durant's maneuver. Where you position the patient in the left lateral Trendelenburg down, that's the head goes down, to prevent the embolism from traveling to the lungs. Okay? So you put the head down so that it prevents the air from going to the lungs, because the embolism can kill the patient. What about pulmonary embolism? You want to elevate the patient's head to a high Fowler position to ease breathing. So if the patient has pulmonary embolism, you want to elevate the head. If the patient has air embolism, you rather want to use the Durance maneuver. So that is why we have these two pictures, the Durance maneuver and then the high Fowler position. So please remember the difference. Which one will you use for air embolism? I'll use the Durance maneuver so that the embolism does not travel to the lung. But in pulmonary embolism, I'm going to elevate the patient's head to a high Fowler position to ease breathing. What about if I need to do tracheostomy care? Tracheostomy care, I'm going to keep that patient in a semi-Fowler position or a Fowler position. And this will aid breathing. It will aid breathing to provide comfort to the client. Now the semi-Fowler or the Fowler position. What about if we have a baby or a patient who has cleft lip and cleft palate? What kind of position do you want to keep the patient in? You want to keep the patient in an upright position during feeding because of the space, in the clefts. Because if you don't do that, they can easily aspirate. And in a post-op situation, the child must be placed prone. For lip surgery, avoid prone position. So these are hard facts you need to learn for your NCLEX exam so that you can be able to ace it very well. Okay. And then we also have which position are we going to put a patient who has prolapse of the umbilical cord. We can put the patient in the knee to chest position, which relieves pressure off the umbilical cord. Okay, so the patient's knees are flexed towards the abdomen, or you can put the patient in the Trendelenburg's position, because as I said, with the Trendelenburg's position, you are reducing pressure which is going from the pelvic and allowing the pressure to move towards the upper part of the body, right? Don't forget that in the Trendelenburg's position, the client's head is down and the legs are up. Trendelenburg's position, right? Good. And then what about if you need to do a liver biopsy? You need a liver biopsy. You need to position the patient on their right side to apply pressure and prevent bleeding. So you need to put the patient on their right side to avoid to apply pressure and to prevent bleeding. So with all that we've learned today, we are going to get into some questions. It looks like people are following. Lana Bats is really following carefully. So we are now going to get into some questions. So please, if you are ready for questions, just type yes. With all that we've said, now we are going to try some questions, because as I said, it is not enough to just learn. You need to try some questions. So with what we've studied, we're going to get into some questions right away. And I'm really excited about it. So let's get going. Okay, let's get going. Okay, so people are saying yes. Okay, let's get going. Let's try some questions now. Okay, first question. Mr. Davis has just undergone liver biopsy and is being transported back to his room. In which position should Mr. Davis be placed to prevent complications? A, right lateral position. B, supine position. C, left lateral position. D, high Fowler position. This patient has just had liver biopsy. You want to avoid complications. How will you position the patient? A, right lateral position. B, supine position. C, left lateral position. And D, high Fowler position. I see a lot of people going for A. Does anyone have a different answer? It looks like the jury is out. The answer is A. So the rationale is very simple. We will use the right lateral position. After a liver biopsy, placing the client in the right lateral position helps to apply pressure to the biopsy site and reduces the risk of bleeding. That is why we put the patient in the right lateral position after liver biopsy. Let's go to our next question. Mrs. Martin is experiencing acute respiratory distress and needs immediate intervention. Acute respiratory distress and needs immediate intervention. Which position should the nurse use to help alleviate Mrs. Martin's symptoms? A. Low Fowler position. B. High Fowler position. C. Supine position. D. Reverse Trendelenburg position. Are you going to go for low Fowler? Are you going to go for high Fowler in the patient with respiratory distress? Are you going to go for supine position, or are you going to go for reverse Trendelenburg position? So it looks like a lot of people are going for B, 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 B. Looks like a lot of people are going for B. All right? B. And B is the high Fowler position. Beautiful. It looks like we are getting it. Looks like the class is coming along. And I really, really like what I'm seeing. Okay? Looks like we are getting it. Okay. So let's go to the next question. And what is the correct answer? The correct answer is B, high Fowler position. Remember that high Fowler position maximizes chest expansion, which is needed and which is essential in relieving respiratory distress. So high Fowler position is what we will go for. High Fowler position. That is what we will use in this particular patient who has respiratory distress. Okay. Let's go to the next question. Mrs. O'Connor has just had a seizure, and the nurse needs to ensure she's safe and in the correct position. Which position is best for Mrs. O'Connor after her seizure? A, supine position. B, high Fowler position. C, left lateral position. D, prone position. Please type in your answers. I want to see your answers right away. I want to see your answer. Which position will you put this patient who just had a seizure in? Are you going to put the patient in the supine position, in a high Fowler position, in a left lateral position, or in a prone position? And what is the jury? A lot of people are going for C, 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 C. Many people are going for C, C. And I think that many people are correct. Many people are correct. Left lateral position is recommended after seizure. Awesome job. Awesome job. I'm very happy about how we are going. Next question. Mr. Green is experiencing delayed gastric emptying after a meal. Which position should the nurse encourage Mr. Green to assume? Delayed gastric emptying after a meal. Which position should the nurse encourage Mr. Green to assume? A, semi-Fowler position. B, supine position. C, prone position. D, left lateral position. Delayed gastric emptying. Which position will you put the client in? Which position will you put the client in? Delayed gastric emptying. Delayed gastric emptying. Which position will you put the client in? Delayed gastric emptying. Delayed gastric emptying. Let me see the answers. Some are going for C. Some are going for A. Some are going for A. Some are going for C. What's the correct answer? What's the correct answer? Drum roll. What's the correct answer? The answer is A, semi-Fowler position. Semi-Fowler position. You want to put the client in a semi-Fowler position. Remember, semi-Fowler position aids in digestion and prevents aspiration. Semi-Fowler position will aid in digestion and will prevent aspiration. Okay. Next question. Mrs. Johnson is scheduled for a routine pelvic exam. Which position should the nurse assist Mrs. Johnson into for the exam? Pelvic exam. A. Supine position. B. Lithotomy position. C. Trendelenburg position. And D. Prone position. Are you going to go for A? Are you going to go for B? Are you going to go for C? Are you going to go for D? And it looks like we have people who are going to go for B. Mrs. Johnson needs a pelvic examination. Pelvic exam. And the answer is lithotomy. Remember that lithotomy, we said it's like the swan neck. The hip is flexed, the knee is flexed, and the leg is placed on, stirrups to help, right? The lithotomy position is the standard position for pelvic exams and childbirth. Beautiful. So today we are mastering positions that we can put our clients in for maximum benefit. Okay, next one. Mr. Patel's blood pressure has suddenly dropped, and the nurse needs to position him to improve his condition. Which position should the nurse place Mr. Patel in? A. Trendelenburg position. B. Reverse Trendelenburg position. C. Supine position. And D. High Fowler position. You have somebody whose blood pressure has suddenly dropped. Which position will you put the patient in? So we have a lot of people going for A. Okay, good. Beautiful. So a lot of people are going for Trendelenburg position. Remember that in Trendelenburg, you put the head down, the legs go up. Why? We want more blood to flow to the head, right? Okay. And this patient has hypotension. So that's what you want to do. So, dear nurses, dear NCLEX champions, we are learning something very important. Patient positioning is critical for patient comfort. If you want to ace the NCLEX, you need to always know which position applies to which specific medical condition. Okay? You need to know which position applies to which medical condition. So what we will do is we will make the mock available to you right away. I'm going to send the mock to you. But before I send the mock to you, I'm going to let you know something. Like what we've done today, I don't think you need to revise positioning anymore. You are done. You don't need to revise positioning anymore. This tells me that it is good to always have a very good background, so far as using mock exams in your preparation is concerned. So I'm going to share the link so you can try your hands on more questions. Please, I have a question. How will you put today's class? Was it helpful? Was it not helpful? Has it helped you to appreciate some concepts better or no? How will you put today's class? Don't forget, I'm going to do a mock right now. But before we go on to that, I want some feedback. And I also want to know that somebody wants to join me. If you want to join me right now, I'll be very glad to have you. So maybe you can speak about the class with me. If you want to join me right now, I've put the link in the comment section. If you are in a place where you can join me, I've put a link for you to join me right now. You can just click on it and join me. I'll allow you to join me, and then we can have a conversation. What have you learned today? What are your take-home points? How are you going to use that to aid your NCLEX preparation? Lana, will you want to join me right away on this live? Does anyone want to join me live before we get into the mock exam? Does somebody want to join me live right now? I'm putting the link in the comment section right now. If you want to join me, let me know. Who wants to join me? Grace, will you want to join me? Kokila, will you want to join me? If you have your camera is on and everything and you want to just speak to me, how has the class helped you? Because we're going to do the mock exam. I'm going to put a link for the mock exam right away. But I want to know, how has the class helped you? So Grace says, very helpful. Deep Kara says, excellent class. Lana says, very helpful. Beautiful, beautiful. So I'm putting the link. If you want to join me, that is fine. You can just click on the link and then you can just join me and then we can have a conversation. If not, I want you to know something. Before we take the mock exam, I want you to know something. You don't want to miss an opportunity to practice cases, right? Because it's not enough just to have knowledge. Because with what we've done today, we've gone through the knowledge. Now we've gone through questions and you're going to do a mock as well. Okay. And that is why I don't want you to miss this. Because we are going to get you 100 MCQ questions. Those who took the mock the last time, it really, really boosted their morale. And it helped them to understand where their weaknesses are. And that's exactly what we are going to do for you. So we have a mock coming up. This is different from the mock you're going to do today. This particular mock, 100 questions. You come in, you do the questions. It reveals your weaknesses. All right? It reveals your weaknesses and it helps you to know how to get the best out of it. I want to know who is interested in this particular mock. It's only for $29. $29, you can just take it to the restaurant and just get a nice meal. But you are going to use that $29, to gain a lot of knowledge. So I think somebody is trying to join me on the live, but I want to invite you for this very, very important mock exam. It's going to be a live mock exam. It will just be like your NCLEX exam. You will have an invigilator, So I want to know who is interested. If you're interested, just type interested. I will send you the link right now and you can use it to register. It's only $30 for 100 MCQ type questions. It is live, it is remotely proctored, and you have an invigilator watching over you to put you in the exam situation. Who is interested in it? Okay, beautiful. So I see some people are interested. So what I'll do is I'm going to put the link in the comment section right now. Okay, I'm putting the link for the mock exam in the comment section right now so that you can use it to, register for it. Only $29.99. Canadian, not US dollars. Canadian dollars. Beautiful. Lana says she's interested. Good. So Lana, I've put the link in the comment section. I've put a link there. So you are joining us on YouTube. You will see the link. It's in the comment section right now. Lana, welcome. So just click on it. Just for $30, come for a hot mock. Okay, hot mock exam, and let's get it going. Secondly, before we do the mock exam for today, I want you to also know that we have specially crafted classes, which we also do. And in these classes, you have over 500 short videos which cover all the concepts you need to learn so far as NCLEX is concerned. In the class, we'll also give you workbooks. We conduct the classes twice a week. You even have a notebook which contains, what we call the NCLEX snapshots. And you even do mock exams. And on top of that, we'll get you a mindset coach. A mindset coach as well. So this is also part of the programs we offer at MedCognito. All right. And, you have your downloadable materials there. You have your NCLEX live classes replays are all loaded for you. Fluid and electrolyte imbalances are made available. Safe and effective care environment, safety and infection control. Everything you need for the NCLEX is there. Only for $199. And on top of that, we also do high yield reviews. So we have high yield review 1, high yield review 2, high yield review 3. Right? And all these go on to help you. So we will take you through a class in oncology, musculoskeletal system, dermatology, everything. Only for $199 a month. Can you imagine? You're going to get all this for peanuts, because we want to make sure that your NCLEX preparation is top notch. And this is one of our key tutors, Dr. Julia, very wonderful physician who also helps in the preparation of NCLEX. Okay, so people say, it's been good so far since I'm gathering the courage and knowledge to write my NCLEX exam. It's been awesome. Some also say, thank you for the beautiful and encouraging words. So the same way that you enjoy the class today, that's the same way that the class you'll be doing with MedCognito will go. Okay, so those who want to take the mock exam, I'm putting the link in the comment section right now. I'm putting a link there. Just click on it. It will help you to get your registration going. Then you can join us. All right. And then for those who want to get into the MedCognito NCLEX preparatory program, if you enjoy the way we taught today, that's the same way we teach. Okay. And don't also forget that you can also join our private Facebook group. It is open for you. I'm putting the link as well. Remember, you're going to do a mock exam. Our private Facebook group, I've also put a link there for you. All right. So make sure you register for the mock exam, 100 questions. Make sure you've joined our Facebook group. Make sure you've jumped onto the MedCognito plan. So if you want the access to all our materials for just 30 days, it's only 199 Canadian dollars. If you want it for 6 months, it's 997. And we've even made a payment plan available for you. Okay? A payment plan has been made available for you. And you can pay it one time, over 2 months, over 3 months, over 4 months. All those things are there. So that's what I was saying. So you can pay it one time. That's 997 for 6 months, where you're going to get coaching and everything. Okay? Or you can pay $499 for 2 months and you still get access for 6 months. Or you can pay $349 for 3 months and you get access for 6 months. Or you can even pay $199 for 6 months every month. $199 towards your NCLEX preparation. You will get your workbook, you get your books, you get your study guide, everything. You get your coaching as well. So I want to see you in the mock. I want to see the MedCognito program. Now, to do the mock exam for tonight, I'm just going to share the link. Do it, submit it, and you'll be getting your feedback. Okay? Do it and make sure that you've also submitted it, and then you'll be getting your feedback. So I'm putting the link in the comment section. So click on it right now. Click on it, and you can be able to do your mock right now. Click on it, and you'll be able to do your mock. Do you have any question? Any question? Any question? You can reach out to MedCognito right now. Any question? Any question? Let me know. If you have any question, just let me know. Okay? If you have any question, DNSs, if you have any question, just let me know. Beautiful. Looks like we have somebody who has just registered for the mock. Beautiful, beautiful, beautiful. Somebody just registered for the mock. Okay? Lanigaria just registered for the mock. So I'm putting the link to the mock you'll be doing tonight. It is there. Just start doing it right away. Okay? Just start doing it. And I'm going to click on it and then show you how it will appear. So if you open if you go to if you click on the mock, let me stop sharing this. If you click on the mock, I'm just going to share. If you click on the mock, this is how it will look like. Okay, this is how the mock will look like. So you just have to put in your email address. This is free for today. This is free. Okay, this is free, and then you just go through everything. So please make sure you solve this, and then and when you are done, click on the submit button. 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 Okay, and for the mock, someone says it says the code is wrong. Let me see. So you need to put in your email address first. Put in your email address. Okay. put in your email address, and then after that, it will open up for you. Is that what Lana? Is that what you're worried about? Because it says I'm lost. Where's the link for the mock? Lana, which mock do you need? The mock for tonight or the 100-question mock? Which one are you talking about? Because tonight you have a mock. This one is free. This mock I'm showing you is free. And then we also have 100-part mock that you need to do. That one will be live. That one is the $29.99. So which one are you talking about? I want to know so that I can help you. Okay. So for tonight's mock, this is how it is. It's about 10 questions. Okay. It's about 10 questions. So do that. But which one are you worried about? So Lana, for tonight's mock, just I'm going to send a link again. For tonight's mock, look in the comment section. You see the link right now. Okay? You see the link. And then for the upcoming mock, which is just $29.99, I'm going to put the link as well in the comment section. All right. Dear nurses, do it. Send the answers to us. And then you can join our Facebook group, and then we can discuss the concerns there. Okay? Thank you very much. It was a pleasure talking to you tonight. Always, as usual, this is Dr. Bruni and the MedCognito team coming your way. Thank you, thank you, thank you, thank you, thank you so much. Enjoy your evening. Thank you. Enjoy your evening.